Let's talk about the the three most common soft tissue treatments that we offer
Okay.
and why.
So when you say common treatment, why are they so common? Let's start there.
Yeah, so, like we were talking about last time, a big emphasis that we put on things here at the clinic is the soft tissue, right? We talked about the physical therapy pillar, we talked about the soft tissue pillar, and we talked about the chiropractic pillar. So everybody's seen the videos, everybody knows what it looks like to come and get adjusted, to get cracked, right? But what about the other side? What about what we do to the muscles and how the muscles are affected and why they're affected, right? So a little bit like we were talking about last time was the nerves that come out from the spine, right, branch out and innervate or activate the muscle, right? So like I was explaining, you can't have a muscle injury without some type of spinal involvement, and you can't have a spinal involvement without some type of muscular irritation. They go hand in hand. So the three most common soft tissue treatments that we offer here are cupping, dry needling, and Graston therapy. So let's break down each one. The reason that I use cupping in here every single day, right, is because cupping is the only soft tissue treatment that we have available that actually lifts the tissue up, right? So massage, acupuncture, chiropractic, even stretching, right, tightens the tissue and pushes the tissue down, right? Cupping is literally the only treatment available that lifts the tissue up and separates the tissue.
How does that help?
Yeah. So in between each layer of skin, there's like 5 or 6 of them. You have lymph, you have fluid, right? And when the tissue is irritated, the inflammation can get trapped in between these layers of skin. So by separating the tissue, we can allow the filtration of inflammation in lymph to pass underneath, allowing it to filter out, decompress that area, draw blood flow to that area, therefore speeding up the healing process. We're in the business of getting people better as quick as possible. You know what I mean?
And do you think everybody should do cupping? Or is it cases by, like, is it per case?
Yeah, so I think in the end of the day, what it really comes down to with the cupping is how does your tissue feel? Some people, they may not be as tight as other people. If your tissue isn't as tacky, isn't as tight, some people have good range of motion. Some people don't feel as tight. Maybe they just feel a knot. Maybe they just feel, I don't know. You know what I mean? I would say more often than not, the cupping therapy is appropriate, right? I don't use any treatment in here on 100% of the people 100% of the time, right?
Yeah.
Each treatment is catered towards what are your goals, what are your capabilities, and what's going on with your body at the moment. You know what I mean? So each person has their own tailored treatment plan, but I would say more often than not, I tend to use cupping in some form of the treatment plan, which again decompresses and accelerates the healing process. So that's the cupping side of things, right? The other new one that we've been using over here for the last, 2 years now has been the dry needling. And I'll have to say, in the 2-year span that I've been doing it, the results that I've been getting with the dry needling have been insane.
So explain dry needling a little bit for people who might not be aware of.
Yeah.
Because people hear, oh, you're going to needle me.
Sure.
That right there just get their anxiety to like 200%.
Right. So the needle is actually super thin. One of the most common feedbacks I get while I'm actually needling a patient is, hey doc, did you put the needle in yet? Meanwhile, there's already 3 or 4 in them, right? Because it's so thin, a lot of times they don't even feel it.
Yes.
You know what I mean? I think the 2 most common questions when it comes to dry needling are, 1, how is dry needling different than acupuncture, right? And then 2, what exactly is it doing, right?
Yes.
So let's talk about number 1. How is dry needling different than acupuncture, right? So acupuncture is based on meridian or energy points in the body, right? So if you have pain in your shoulder, they may put some in your head, they may put some in your hand, they may put some in your lower extremities, right? Dry needling is more musculoskeletal based, right? So I have pain in this spot, I feel the tissue, I feel the restriction, I feel the muscle knot, I put the needle right into the site of where we feel pain, right? As far as the actual application, how it's put in, the size of the needle, for the most part, that's all the same, right? One is really just based on musculoskeletal in the dry needling aspect, and one is based more on energy or meridian points in the body. Not downgrading one or the other. Personally, being sports chiropractic oriented, I've just gravitated more towards the musculoskeletal treatment in dry needling. So that's how those two things are different. As far as what it's actually doing, right? The reason that dry needling has been found recently to be so effective is because, let's say that this is the tissue, right, and this is the bone, right? So let's say that the knot or the issue or the irritation is on the superficial layer, right? So my thumb or the cupping or the elbow, right, that may get the upper layer of the issue, right? Yeah. But let's say the issue is all the way at the bottom near the bone, right? So the needle will get the upper, the middle, and the bottom layer. So some would argue that that's the most effective treatment because it's getting everything in one. You're not figuring out from session 1 to session 2, how effective was I deep enough, did I actually get the rooted issue, versus I'm getting all the layers of the cake, now I know that, I'm covering all of my bases. You know what I mean?
Yeah.
So that's been one thing that I've found, that the depth of how far I can go into the tissue releases more of the muscle, getting people better quicker. Again, it's been 2 years since I've been needling, and in that time, the results that I've been getting time and time and time again have been insanely, overwhelmingly positive. You know what I mean?
Now, again, I would ask, this is just like I asked for cupping, do you think, is needling one thing that everybody should be doing? Yes. Except for those who have needle...
Yeah. Listen, if you have a fear of needles, right? If you have a fear of... or if you have like a bleeding disorder, right? Okay. Or you have some type of contraindication to getting needled, you shouldn't do it, right? Just like when people come to me. Sometimes people come and they say, hey, doc, I got neck pain. I don't want my neck cracked. Right? Yeah. That's okay. There's ways for me to heal your neck without cracking your neck, right? Yeah. So I'll always present to my patient what I think will be the best. Sometimes people say, hey, I don't want to get cupped, right? Hey, I don't want the needling. I don't want to get adjusted, right? That's okay, because I have multiple tools in the toolbox to get you to where you need to be. So the other interesting thing that I found recently about the dry needling that I've found to be also super exciting is I'm getting orthopedic surgeons, right, who have either just done surgery on an ACL, who have just done a microdiscectomy, removing the disc from the spine, putting an artificial one in for somebody who has a disc herniation. These doctors, right, are reaching out to me specifically and asking me to dry needle their patients, right? The results that is going around the medical community as far as the changes that it can have to the tissue to not only release the tissue, but signal blood flow to the area is becoming much more well known, to the point that these practitioners are actually reaching out to manual therapists like myself and saying, hey, on top of the physical therapy, on top of the stretches, right, I want you to dry needle my clients, right? So I'm dry needling them, and the changes that these patients are having in not only pain, but in range of motion and function of the tissue, again, are overwhelmingly positive. This is a new treatment that is becoming more well known that every practitioner should be doing at this moment.
Doctor, I went to see an acupuncture, and after they're putting all the needles on my back, the best nap I've ever had for 20 minutes. I was passed out. I don't know if I was tired or whatever, but it felt good.
Yeah.
That 20 minutes felt good. So I really, needling, of course, is different, but similar.
Yeah. Here's what I would say. If you've gotten acupuncture, try dry needling.
Yeah.
Compare the two. I know people that have gotten acupuncture and swear by it, right?
Yeah.
I also know people who have gotten acupuncture and haven't felt the difference. Personally, for me, I like treatments that are geared towards where's my pain, right?
Yeah.
Now listen, we're always going to identify the root. It's possible that the area that you're having a dysfunction isn't where you're having pain. So I think you have to focus on both, right?
Mm-hmm.
But if I have pain in a specific area, the first thing I want to be out of pain, right? Then I want to figure out why I'm in pain and start working on the root cause while I'm working on the symptoms at the same
Where's it
time.
originated?
You know what I'm saying?
Yeah, I remember
they're both important.
One day when I came up to you, I had this shoulder issue, and
That's right.
you worked on the lats.
Yeah.
Because, and a lot of time people forget that. I was like, oh yeah. Like sometimes clients will complain about elbow pain, not realizing the problem could be either coming from the shoulder or the wrist. Sometimes people forget. Just because it's hurting at one place doesn't mean it's originating there.
People actually forget that the lat muscle wraps all the way to the posterior part of the spine and attaches to the lower thoracic spine and the upper lumbar spine. You know what I mean? And since we're all internally rotated like this, a lot of times people will have lower back pain, right? And at the same time, they're so tight through their lats, right? And that's what's really kind of causing this issue, tugging on that lumbar spine.
I blame it on people making the chairs, man, because everything is getting smaller and constricted.
Maybe you're getting bigger, man.
Like plane seats? Oh, man, those are a disaster.
Right. Well, it's fine for me.
Good for you, bro. Try me more.
Yeah, I don't need the extra leg room.
That's good. So let's talk about the last one. What is it called again?
Yeah, so the last one is Graston Therapy, right? So Graston I use specifically to break up muscle tissue and scar tissue, right? So let's say you've had shoulder surgery, let's say you've had knee surgery, or let's say that you've just had a bad sprain or a strain, right? These are all things that cause tissue changes, and the body is smart, and when it has injury to an area, the natural tendency is to harden. Same reason why when you have a back issue, the muscles in your lower back lock up. Why? To prevent further injury, right?
Yes.
So when these muscles lock like that, what ends up happening is the tissue over time ends up calcifying, right? And what the Graston therapy does is it goes up and it breaks up these muscle adhesions.
And the Grafting Tool is the one that looks like a butter knife.
Yeah, nowadays there's a lot of different ones. There's the big handlebar one.
Yeah,
there's the butter knife looking one. These are stainless steel tools that were actually, it's interesting, it was actually ancient Chinese medicine, right? Westerners westernized it, right? Turned the gua sha tool into a stainless steel tool, called it Graston, and now we steal all their ideas.
Yeah.
You know what I mean? Similar to the cupping therapy. But nonetheless, yeah, so it breaks up the muscle tissue, breaks up the scar tissue, again, signaling blood flow to the area, increasing range of motion, and overall promoting healing. All of these treatments that we've talked about, from the cupping to the dry needling to the Graston, are supplements, right? We're not putting all our eggs in one basket, right? It's in addition to the physical therapy program. It's in addition to the spinal corrections and alignments. It's in addition to updating your ergonomic setup, your sleeping position, your lifestyle modifications. Everything goes in hand. But those three soft tissue treatments, in some combination, have been extremely beneficial to getting people back on track much quicker than they would by going to a practitioner that only does chiropractic or only does physical therapy, right? Here at Optimal Performance, chiropractic, physical therapy, and the soft tissue pillar are all getting done in one session, which is second to none at this moment.
Now, I'm gonna go back a little bit.
Is that the same? Is it second to none?
Second to none?
We'll have to get a look up on that.
What's the first one?
Cut that one out.
So, while we had, and you mentioned ancient Chinese medicine, right?
Yeah.
So, I want to talk to you a little bit more about the cupping.
Yeah.
Because when you look at the data, there's no data that supports it. And a lot of people don't believe that cupping does anything.
Sure.
I've heard of, in my field, I hear a lot of people it's not that it's not working. They just don't believe in it. They don't think it does anything.
Sure.
But then you tell them, okay, why are the people in China or other places now been doing it for hundreds of years?
Yeah, so here's the story of how cupping got so popular. It exploded onto the scene during the Sochi Olympics when Michael Phelps won like 100 gold medals, okay? He did it with cupping marks all over his chest and his back. Cut to that point, pull up the picture on Google Images and throw it in the video because you're going to see this picture of him doing like a butterfly stroke with just cupping marks all over his chest and his shoulders, right? Okay. The reason that it got so popular at this point, everybody's like, why is this guy winning so many gold medals, right? Meanwhile, he's doing it with these cupping marks. So that's when it started getting research, right? That's when people started really looking into it. And what they found was it decompressed the muscle tissue, right? So from all the movements that he was doing, it was tightening up his muscles. So decompressing allowed greater range of motion. Greater range of motion means greater stroke, means quicker in the water. You know what I mean? The second thing it was doing was it was bringing blood flow to the area. People always ask, what are the spots? The spots are blood flow. You know what I mean? I'm drawing blood flow to the area. Blood flow is full of nutrients and oxygenating factors that both hydrate, nourish, and promote healing in the area. You know what I mean? So those two things are what really brought everybody's attention to it. Now listen, one thing about evidence and data and proof that you have to take into consideration is there's a few different things, but what it really comes down to is two aspects, right? What is proven in literature, right? But the other thing that you have to consider are what are patient outcomes, right? These two things have to be valued, right? Patient outcomes is extremely important, just like what's actually proven in data, right? What I'm finding is that when I add the cupping into the other treatments that we offer here, the results happen and we get people better and pain scores go down a lot quicker. You know what I mean? Every treatment that I offer in this office are only things that work on me personally, because then I can actually get behind it, right?
Absolutely.
I get cupped.
Yes.
Right? I get needled. I get grafted. I get adjusted.
Video on that.
Behind the scenes footage.
Absolutely. Because, practice what you preach.
They want to see me in pain. Exactly. They're like, you caused me all this pain. Let's see you in pain, Doc. Nah, it's not painful.
But no, that's good. I keep telling people, look, if it was useless, then you wouldn't have these new celebrities and athletes doing it.
Did you see the picture of The Rock?
Yeah.
He posted it with the cups on his back. Also, Kevin Hart.
Absolutely. And now then after that, the whole ice bath, the cold therapy, I forgot there's a word for it, cryotherapy.
Yep.
That got into the attention, and people like, oh, well, this is just a placebo effect, just like cupping and needling. I was like, listen, you can't talk until you do it yourself and experiment.
After your first cupping session, after your first dry needling session, you should feel some difference, right? It's very, very rare that people get either one of those treatments, get off the table, and look at me in the eyes and say, I feel exactly the same, right? Everybody gets off and says, wow, that feels so much better. Wow, I feel so much looser. Wow, I don't feel as tender in my glute after you did the needling. Wow, my upper back after you did the cupping just feels totally open now. I feel like I got so much more range of motion. Those are common things.
The way you explained the cupping, man, makes me feel like getting something done today.
You're nuts.
That was good.
This is typically what I ask people. Like they say, which treatment should I do today? So I ask them, tell me what you feel, right? If they tell me that they just generally feel tight, right? I'm thinking that the cupping is going to be the most effective, right? But if they're saying like, I feel it like deep in my joint, right? Like I feel like a deep knot in there. Then I'm thinking, okay, let's go with the dry needling, right? You also have to think about the area of tissue that you're working in. So if I'm working in the hips, in the glutes, a lot of times the needling is going to be the most effective because the needle is going to go much deeper. Those are higher tissue areas.
Especially for somebody who has a lot of muscle.
Right.
Which just makes it more difficult to just cup them and send them on their way.
Absolutely. But then like the upper back and traps area,
Yeah.
those are usually, you know, tighter, more superficial muscles,
yes.
right? So I can go with the cupping, right? That's going to decompress there versus like the hips, the glutes, and the hamstrings, where maybe the needling would be more effective.
Yeah.
Hey guys, thanks for watching. Don't forget to hit that subscribe button, like this video, and we'll see you in the next one.